All my life, I've had a bad experience everywhere I've been to the dentist. I've had one bad experience after another. I had a tooth out with a dentist surgery where I live, and that came out all infected because he was poking about, in the gum, and that was all infected. Then I had a scale with another dentist, and my gums were all sore and bleeding, red. It was a bad experience there. I had a dentist in my hometown, but I had very bad experiences from them. They took a tooth out, and I could feel them pulling it out, and I was coming out of the chair, and I had to take pain relief in the surgery. That was years ago. But I've changed to a different dentist, which is 20 miles away, and they're very good dentists. And I explained the situation to him that I felt the tooth coming out, and he said I shouldn't have felt nothing when it came out. She gave me 2 injections, and then another tooth had to come out on the other side. He's given me three, and I had no problem at all. I didn't feel the tooth coming out. And he said that's how it should be. You shouldn't be able to feel your tooth coming out. I heard someone said that these dentists were good, and they especially treat you better when you're a bit nervous of the dentist. There's a very young girl there, and she was marvellous. I felt nothing, but I'm just petrified of dentists anyway. But I'm fine with this one. They talk to you and calm you down. They say this won't hurt, and then they send you into the waiting room for stuff to take effect, and then they call you back in 20 minutes later. The dentist I went to before didn't take me out the room. She just started straight away the treatment. I had a lot of infections in my gum, and I think it was to do with hygiene. I wasn't keeping up with hygiene for my dentures. I was sleeping in them, and you're not supposed to. You're supposed to take them out. I should have just taken them out, but I just can't be bothered. I'm lost about my teeth. I know I've got to take them out at night. And I brought some Corsadil mouthwash, which is fantastic. Then I brought some Sterident tablets, and I soak them every night now, and I've had no problems since. I started taking them out now at night. I've got a top denture, and I broke my bottom denture, but I can't get to see a dentist at the moment until May. So I've got to have a new denture made. I broke them months ago now, about 3 months ago. We super glued it, and it's just so uncomfortable. I can't wear it. It's worked, but it's rubbing against my gums when I put them in, so I can't use them. I've got to go back and forth to the dentist now for weeks on end, to have a filling and something else done, and then the dentures are made. It's going to take me weeks to get a new denture. They tried to get me in earlier, and they rang me and said that the dentist isn't very well. You can't come in. So they made another appointment for me, and then they cancelled it again. They said the dentist is ill, you can't come. And this is my third appointment now. Hopefully in May I can get to see the dentist. It will be nearly 3 months to try and see a dentist now. Before COVID, it would have taken a week or two. I think it's part of because they're trying to catch up with the customers, she said, and they've got a backlog, so it's longer time to wait now. And they've got one dentist off sick. I'm just managing, but I've got to watch what I eat because I can only bite so many things and chew so much food. My bottom denture, I used to bite it, and I can't use it at all at the moment, so it's all soft food really. I brush my teeth and soak them in Sterident every night, and I use mouthwash as well. I use Corsadil when I've got infections. Luckily, I'm still on the books because they extended it. I think it's about a year, and if you don't go, they take you off. You've got to go once a year just for a checkup, whether you've got any teeth or false teeth or what, just to check that you haven't got mouth cancer. And because of the COVID, it went on for 2 years nearly. They allowed an extra year, so I just got in. You'd have to phone the NHS line, and you could go and have a one-off treatment, and that was it. But if you were in pain, they took your tooth out. That's all I knew. I know this because I had to ring the dentist or a phone line for my partner, and I think he went and had a tooth out. It was a one-off. You can't go again. He had to wear a mask, I think, that's all. A friend of mine was in agony with toothache and had to wait 7 weeks to see a dentist. Took painkillers, and eventually she got an appointment at the hospital and had to have 3 teeth out. She was in weeks of pain. The NHS, they should put things online and tell people that they can see emergency dentists. There's a certain number you ring for the emergency dentist. They should all do that, access them. It makes people aware that they can get in contact with them. My partner is scared to go to the dentist as well. He's got toothache and abscesses. His face swells up and he just will not go to the dentist. He just get antibiotics off the doctor, but it's a problem that's going to keep coming back and he won't go. But the doctor's really helpful. They'll give you antibiotics if you can't see a dentist. They'll give you a prescription if you've got toothache and stuff or infections.